We are currently in the month of June, which is recognized as Alzheimer's and Brain Awareness Month. According to the Alzheimer's Association, there are more than 55 million people living with Alzheimer's or some other form of dementia. It's why it's important to have access to this information that we can help identify these symptoms and know how we can help fight back. Joining me now on the Splash Live is vascular neurologist Dr. Schechter for a conversation on Alzheimer's awareness. Dr. Schechter, thank you so much for joining us.
Good morning. Thank you so much.
Absolutely. Really happy to have you with us and really excited to be getting into this very crucial conversation. So first and foremost, what are some key habits or lifestyle changes people can make to maintain brain health as they age?
So I would say staying healthy in general, keeping your body healthy, keeps your brain healthy. Diet and exercise, trying to stay cognitively fit, making sure that you are solving problems and continuing to use the brain in a way that it is stimulated, creates new connections in the brain, and helps to maintain optimal brain health. So physical activity sends oxygen and blood flow to the brain, and then using the brain keeps the brain healthy.
Awesome. Great things for everyone to keep in mind. Now, when it comes to something like Alzheimer's, I feel like a lot of people tend to think of that's something that they don't have to worry about until they reach a certain age, until they're maybe in their 60s or their 70s, but it can happen much earlier. How early should people begin thinking about their brain health, and what preventative steps are the most effective?
So when Alzheimer's develops, it develops over years, not just days or months.
Right.
So maintaining optimal health, as we've discussed, really helps to reduce that risk. Um, I would say maintaining lifelong habits, healthy eating, avoiding processed foods, limiting alcohol, staying physically fit. All of these things can help long term because once the symptoms develop, it's harder to reverse some of those changes. Um, Medications are available now that can help to treat some of the symptoms of Alzheimer's, but they don't cure the condition. They just slow down progression. So being aware and maintaining optimal fitness long term, I think, is the key strategy through healthy living, diet, and exercise.
That's right. Now, I'm sure a lot of people watching this know somebody or have experienced watching somebody that they love deal with something like Alzheimer's. I certainly have in my life. What are some of the early warning signs of Alzheimer's that people often overlook or misinterpret?
Right. So it can be something subtle. It can be a change in behavior. It can be difficulty performing simple tasks. Maybe this individual needs more assistance with their activities of daily living, or they're starting to develop other signs of what we call higher cortical function. Not only memory loss, but they're forgetting how to work simple objects like hold a utensil or turn on the water faucet, for example. It can be any change from baseline affecting cognition, and that really should be when that individual seeks treatment, because the earlier we can treat, the better we can do in terms of slowing progression.
That's
See your doctor. They should see their doctor as well for diagnostic studies like imaging.
That's absolutely right. And I'm so glad you just mentioned something about that. What role would you say early detection plays in managing something like Alzheimer's?
So Alzheimer's is the most common cause of dementia, but there are other dementias, other conditions. Dementia means memory loss. So imaging can be done to exclude multiple strokes, tumors, a fluid buildup called hydrocephalus or water on the brain, or other abnormal structural changes in the brain. There's also more advanced imaging now called a PET scan that can look at amyloid deposition, which is an abnormal protein buildup in the brain, which is one of the hallmark features of Alzheimer's disease. So seeing a neurologist can help distinguish, whether this is Alzheimer's disease or another form of dementia. And it's critical to differentiate between those because treatments may be different.
That's absolutely right. Now, I am curious because with what is the current understanding of some of the causes of Alzheimer's? Would you say they're more genetic, environmental, or possibly a combination of both?
So I think, the biggest risk is age. It's a neurodegenerative condition that increases with age. It can come on in the 50s and the 60s and older, but increasing age increases the risk. Um, so, I think the most important thing is when those symptoms develop, um, proceed with appropriate testing, seeing a neurologist. There's an abnormal protein, as I mentioned, called amyloid. It's a abnormal plaque that can build up on the brain surface, and that can be seen now with PET scan, advanced imaging. And there are some medications that can target and remove that amyloid. Labs should be done, blood work to exclude other treatable or reversible causes like a vitamin deficiency or other nutritional deficiency states.
That's right. Lots of things people can keep an eye on to make sure that their brain health is up to par and make sure that everything is working just fine. For those just joining us
Yeah.
right now on the Splash Live, I'm talking with vascular neurologist Dr. Steven Schechter, talking about the importance of brain health and Alzheimer's awareness as we are currently in Alzheimer's and Brain Awareness Month. Now, Steven, I am curious, what are some common myths or misconceptions that you tend to encounter about the brain that maybe people aren't aware of?
Well, the brain, does have what's called plasticity. The brain can reconnect itself. So some symptoms can improve. We see this after stroke, for example. So when there's brain damage, the brain can also improve. Deficits can change. They can improve over time with therapy. Cognitive therapy, I think, is another important aspect of Alzheimer's disease. That is, with certain techniques, working on so-called brain exercises, one can improve their memory and cognition. So it's not just medication that is the treatment for Alzheimer's disease, but um, working on a program that helps to retrain the brain to improve cognition and recall.
Okay, very interesting things for everyone watching at home to consider. Now, I understand that there is a big connection with brain function and cardiovascular health. Could you go into that a little bit?
Sure. So, like any organ in the body, the brain requires blood flow, it requires oxygen, and it has its own vascular bed. The blood vessels that supply the brain can be impacted in the same way that the blood vessels to the heart can be impacted with certain comorbidities like hypertension or diabetes or high cholesterol. Anything that impedes blood flow to the brain can contribute to cognitive loss. And sometimes we see a mix of conditions. One could develop Alzheimer's, which is neurodegenerative, but they could also have vascular changes, small micro strokes to the brain, and this can further impact and make cognition worse. So that's why, again, optimal physical health with diet and exercise, controlling those other conditions if they're present, cholesterol, diabetes, hypertension, stopping smoking, reducing alcohol, and choosing a healthy diet, more plant-based options, anti-inflammatory foods, all of these things can play a very important role in optimizing brain health.
That's right. All the more reasons to prioritize your brain health. Now, as we
Yes.
said a little bit earlier, there is no current cure for something like Alzheimer's. However, I am curious if you know how close we are to possible breakthroughs in a treatment or a cure for something like Alzheimer's, and if there are any studies or developments that you're excited about at the moment.
Yeah, so a lot of new treatment options have come out, the first in many, many years. We have two agents currently on the market that target amyloid, that plaque that can build up and disrupt the connection of neurotransmitters in the brain, contributing to some of the memory decline. So these are infused medicines where you go to an infusion center and they remove that abnormal protein. And so that can be promising. It's not a cure, but it does slow down progression. There's a new class of medications that are being studied now that target not so much amyloid, but tau, another abnormal protein that can be present in Alzheimer patients that can disrupt neuronal transmission. So targeting amyloid, targeting tau, and then we have some, existing medicines that work on acetylcholine. They're called cholinesterase inhibitors, older drugs that have been around for years. So it might be a combination of all of these, but I am excited about the new therapies because they do offer a greater degree of improvement than what we've seen with existing meds.
And I'm sure a lot of people watching this are going to be just excited about these treatments as well. Dr. Schechter, before we let you go, is there a final message you'd like to share with the public for Brain Awareness and Alzheimer's Awareness Month?
Yes, absolutely. I think, just having that awareness can make a difference because some patients come in and they say, well, I'm just like all of my friends my age. There's nothing really wrong. But it is important to get checked out. I think the best thing is to see a neurologist and be evaluated because then appropriate imaging, blood work, counseling, and diagnostic tests can be performed that can really impact the long-term treatment and management of this condition.
Well, lots of great things I hope everybody takes away from this very important conversation. Dr. Schechter, thank you so much for joining us today here in the Splash Live.
My pleasure. Thank you, Jake. Thank you so much.